This statement is on behalf of International Longevity Centre of Canada and on behalf of the 394 member organizations of the Global Alliance for the Rights of Older People. Responses to the COVID-19 pandemic at all levels of governance have exposed significant gaps and systemic failures in the protection of the human rights of older persons. Across every region, older persons have been denied their human rights, discriminated against on the basis of their age, and subjected to ageist hate speech, stigmatization, prejudice, abuse, and neglect. 146 member states recognize these violations and committed to respecting the rights of older persons by supporting the United Nations Secretary General's policy brief on the impact of COVID-19 on older persons. This commitment, made by 75% of all United Nations member states, means that the open-ended working group can no longer ignore its responsibility to fulfill the mandate given to it by the UN General Assembly to develop proposals for the main elements of an international legal instrument. Since the mandate was issued, a number of member states have blocked progress or stayed silent on efforts to better protect the rights of older persons in a new legal instrument. The discrimination and denial of all older persons' rights evident in responses to the pandemic have reaffirmed the fallacy of their arguments that existing human rights instruments are adequate and there are no protection gaps to fill. To continue to delay progress is indefensible in the face of preventable deaths, restrictions of rights, discrimination, ageism, and neglect that older persons have been subjected to during this pandemic. We, the members of the Global Alliance for the Rights of Older People, call on member states at this open-ended working group to fulfill their mandate and immediately start drafting the United Nations Convention on the Rights of Older Persons. A UN convention would provide a guide on how to fully respect the rights of all older persons in all their diversity and trigger the changes in law, policy, and practice to make this happen. Further inaction by member states in the face of the evidence of the need for a convention is inexcusable.